Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Venditti, our hospital director. Today is day 33, Incident Command, giving you the update from Albany Med on the coronavirus. Let's begin with the numbers in the 5 counties, Albany, Schenectady, Rensselaer, Saratoga, and Columbia. Today, we are reporting 903 people have tested positive for COVID-19. That's an increase of about 100 since yesterday, but we do now know that they're doing much more aggressive outpatient testing. Inside here in the medical center, it has not translated into additional admissions here or in the region. I think in the region this morning, we are flat.
We are flat. We are almost exactly the same as yesterday in terms of total admissions.
Here in the medical center, we have 78. What's the breakdown? So we currently have 42 on the floor. We have 36 in critical care, of which 32 are on ventilators. We had 6 people discharged yesterday, including 3 back down to New York City, which is great news, and 3 discharged back into the region. We had about the same number come in. Since it's the end of the week, I think it's a good idea to refresh ourselves on some numbers. So Fred, let me ask you a couple questions. Talk about transfers from New York City. Did we receive any yesterday? What do the numbers look like?
So we didn't receive any transfers yesterday. Since we began accepting transfers, which was last Tuesday, at the medical center we've accepted 46 patients. The region as a whole accepted about 100. So a fairly large number of patients. Of the transfers that we accepted here at the medical center, a significant proportion of them have gone home now, which is good.
That is great news. Let's talk about the number of people who have been admitted to the hospital. Since this began, we've had 136 people who have been admitted to the medical center. We've had a larger number who tested positive, some who never came into the hospital, but 136 came in. Can you give us a breakdown on those patients?
Sure, Dennis. So about a third of those patients who were initially admitted here have gone home, so that's good. Of the 136 patients that have been admitted, 6 have died. All of them have been on ventilators, so our heart really goes out to those families. We feel bad for them. But of the ventilated patients, 10 have actually been weaned, which is very good, and they're on the road to mending and getting better, so we're happy about that.
That's wonderful. We always talk about PPE. We always talk about masks. One of the people reached out to us yesterday and said, we see that you're now using hydrogen peroxide on your masks. Are you doing that because you don't have enough masks? What's the answer to that question?
So Dennis, we have adequate numbers of masks, both N95 surgical masks and procedure masks. We're disinfecting the N95 masks because we want our supply to last as long as possible. We don't know how long this is going to go on, and we're just being prudent. We want to make sure 2 weeks, 3 weeks, 6 weeks down the road we have enough of those masks.
Okay, very good. Any questions for me?
Dennis, tell us about the practice. You've talked a little bit about that over the past couple of days. Give us an update.
Right, very good. So we're very proud of what's happening in the practice. We've talked about telephone visits. We've talked about video visits. We now can report that we've had 12,000 telephone visits, either completed or scheduled, so that number continues to go up. And now we're offering video visits in 26 of our practice locations, which is remarkable.
That's great.
We've actually completed almost 550 video visits so far. Neurosurgery, urology, medicine, endocrine, these are the clinics that are really out front on that, but we have all the different sites doing it. And emergent care now has had several dozen video visits. If you are somebody who comes to our faculty practice, the way in which you schedule your video visit is through the patient portal, and we'll put that information up on the screen. And if you would like to call and schedule a video visit with our emergent care, the phone number, and we'll put that on the screen too, is 518-264-9000. So those are the ways in which we can schedule some video visits as well.
And Dennis, in the hospital, we've also been working with video. Tell us a little bit about that.
So this is remarkable. So not only are we doing the video visits in the practice, but in the hospital, physical therapy has now had several dozen physical therapy visits where the patient is at home and the physiatrist or the physical therapist is going through the therapy with them through a video link, which is a great way because that patient who is waiting for that physical therapy needs that, and so they're getting that as well. And this is the same department which has done a couple videos for our workforce. They've done yoga video, they've done a HIT video, and they've done a Tabata video. So this is a great way for people to tap into that as well.
Fantastic.
Maybe one day we'll do a yoga video together.
Sure.
We talked about convalescent plasma yesterday, and this has obviously gotten a significant amount of attention for obvious reasons. This is remarkable that we're offering that. I'd like to highlight 3 people who really made this work, and we know dozens have worked on that, but Dr. Subik, who is a physician who leads our blood bank, Dr. Mark Judson, who is a world-class researcher in our pulmonary clinic, and Dr. Dave Judson, who is a critical care doctor, who is really the one who was spearheading that on the clinical front. Thank you to them, and thank you to everybody who's made that happen. We have some interesting and exciting news to report about this.
So we opened up our call center at 9 o'clock this morning. We've already had, Dennis, over 200 calls. And in addition, we've got 15 people coming in to be screened. Now, some of the callers were not sure if they were tested and really had the virus. It's important, the people that can donate need to have been tested, positive, recovered, and are in that either 14 to 28 day window or beyond 28 days to be a donor. Tremendous response.
Tremendous. And another example of how the community has been so magnanimous in the way they've been wanting to help us out with this. 518-262-9340 is the number you call if you're interested in seeing whether or not you can be a donor. So we're going to close up soon. Today I'm wearing emergency medicine. I'm a proud faculty member in that department. The emergency department's been on the front lines from the beginning, starting with our testing tent and obviously taking care of people who come in. So I'm proudly wearing emergency medicine today. Fred?
And I have an OR shirt on. You can read it says OR Strong. Our surgeons, anesthesiologists, nurses in the OR are here taking care of patients, our trauma patients, our sick patients who need to have surgery despite everything else going on in the community. So shout out to them. Great job.
Fred, what's your favorite TV show?
Oh, that's an interesting question. NCIS on Tuesdays.
Okay. I think my favorite TV show is The Office. I love to watch The Office with my family. There's an actor on there called John Krasinski. He played Jim Halpert. And he has a YouTube show called Some Good News. And if you haven't seen it, I really encourage you to get out there and watch it. I think we all need some good news these days, and it's a very uplifting, and it's gather some friends around and watch it. We've been the recipient of some good news this week, and we've really had an incredible outpouring from people. They send us pictures, and schools are sending us notes of affirmation of how proud they are of us.
It's absolutely fantastic. So our command center is in the P building on the 3rd floor, and literally the wall of the hall leading into that command center is plastered with beautiful crayon pictures, some printed pictures, computer printed pictures, I mean hundreds and hundreds of them, thanking us, encouraging us, saying wonderful things about us. I mean, every time I walk through that corridor, I get a little choked up when I read them. It's really tremendous.
Yeah, me too. And I think that the message we want to send back to everybody is we get them, and it means a lot to us that you take the time to do it, and it does make a difference to us that we got them. So
really
thank you
does.
for that.
It really does.
So we're on Friday. We'll be here on the weekend, as always, and we'll pick this up again on Monday. We know this is a special weekend for everybody, and so we ask you to take some time, if you can, with your family in a safe way. And we thank all of you who are caring for everybody here in the hospital, and we ask that you please take care of yourself, take care of each other, and we will see you Monday.